COVID-19 press briefing, our first in a couple of weeks. Today, Mayor Jerry Demings and Dr. Raul Pino will discuss what is on everyone's mind, the Omicron variant, where we are seeing it, and its impact here in Orange County. In this conversation, the mayor will also discuss ICU beds and other details as it relates to the virus. The mayor will mention testing, wait times, and some good news for those wanting to be tested. And of course, there will be a dialogue on the importance of vaccinations, and there is some news for county employees. Dr. Raul Pino from the Florida Department of Health in Orange County will report on important COVID-19 data trending here in Orange County. We'll begin with the mayor.
Thank you, Dr. Williamson, and thank you to all of you for being here today. Let me begin by just saying to our community, I hope all of you had a Merry Christmas, and we look forward to a Happy New Year, a better year in 2022 than we've had here in 2021. This will likely be the last press briefing that we will have regarding the COVID-19 virus in 2021. A long way to get here, but this is our 168th press briefing. It has been 2 weeks since we held our last coronavirus briefing, and I want to hold an update today to make certain that we are as transparent as we possibly can be with our community so that you have reliable information. This, unfortunately, would not be what I would call a good news press briefing or conference, but at the conclusion of the briefing today, we hope that our residents leave highly encouraged about where we are in our fight against COVID-19. When we last spoke on December the 15th, the Omicron variant had just been confirmed in our wastewater system. It has now been confirmed through cases here within our area that Omicron is definitely here within Orange County now. I'll leave it up to Dr. Pino to talk more specifically about that. Over the past 2 weeks, it has taken hold and now has everyone's attention in our community. We know that it is highly contagious, but results in less severe illness than the Delta variant. I want to share with you that personally, I have family members who have likely contracted the new variant, COVID-19, but they were fully vaccinated. And so that's the good news, is that if you're fully vaccinated, it will have less of an impact on you. Dr. Pino, of course, is our medical and local health officer, and he will share additional information with you about the perspective from what the Florida Department of Health in Orange County is now seeing within our community. But I do want to report to you that yesterday, the Florida Hospital Association released some very encouraging data. On August 23rd of this year, our state hit the peak for the Delta variant with some 17,121 Floridians who were hospitalized at that time. Yesterday, on December the 27th, there were 2,075 Floridians hospitalized, likely with the Omicron/Delta variants. Back on August 23rd, only 4.7% of ICU beds were available. Yesterday, when we did the census, 31% of the ICU beds statewide are available, which is a significant number. My message to our residents is simple. Don't panic. This is no time to panic, but we are seeing very large numbers, and we can manage this spread and outbreak by simply continuing to get tested and to get vaccinated. It does pose a significant threat to our workforce, and across Central Florida, we are seeing shortages for various businesses and their current employee. We are in touch with all of our hospitals on a regular basis to monitor the current situation. Although there are breakthrough cases, vaccinations and booster shots remain the best protection to lower hospitalizations and save lives. Heading into the new year, we need to remain cautious and practice tried and true COVID safety measures during the pandemic, like wearing masks, washing hands frequently, and socially distancing in crowded spaces. As for testing, the line at Barnett Park closed at noon today, and there is a 5-hour wait. This speaks favorably to our residents wanting to know their COVID status. The Econ Park location closed today at 1:15 p.m. Due to this overwhelming demand, Orange County will be opening a third testing site on Thursday of this week. Plans are being finalized to open a testing site at the South Orange Youth Sports Complex, which is located at 11,800 South Orange Avenue here in Orange County. As you already know, we opened our second testing site at the Econ Soccer Complex on Yates Road on Monday of this week. It, too, was quickly overwhelmed with residents seeking to be tested. In fact, yesterday alone, our health services workers administered a combined 3,000 plus tests between Barnett and the Econ location. To put the number into perspective, in mid-November, we were only doing 300 to 400 tests daily. 300 to 400 tests daily. In less than 1 week, Orange County has now tripled the number of tests being done daily. Let me point out, from a local perspective, we've not received any assistance from the state of Florida at our testing sites. Local governments have been left to figure it out and respond on our own. We are doing the best that we could do to take care of our residents during this current surge, just like we have been doing throughout this pandemic. Our residents, all Florida residents, should be outraged, and they should ask the question, now, where is our state? Where is our governor? Where is Ron DeSantis now? When was the last time you saw the governor do a press briefing regarding COVID-19? Back on November the 18th, he held a press conference. At that time, he signed into law legislation that effectively prohibited local governments from being able to take charge and lead in our fight against COVID-19. Our residents, Florida residents, ought to be outraged and ask, where are you now? So, due to the demand, our health services workers are continuing to ensure that our residents are able to get tested and get vaccinated. Health services workers are on site at Barnett. The lines, people are lining up as early as 7 a.m. when the gates to all of our testing sites don't open until 9 a.m. Due to the demand, the Econ and South Orange testing sites will change slightly. Starting Thursday, they will be open from 9 a.m. until 5 p.m. or until capacity is reached. Barnett Park's hours will remain 9 a.m. to 4 p.m. or until capacity is reached. The testing sites will be closed for the New Year's holiday on Friday, December the 31st, and Saturday, January 1st. Effective immediately, Orange County testing sites will allow walk-ups. We ask that you go to our website at ocfl.net/testing if you need more information. As I said earlier, It is so important now more than ever to get your COVID-19 vaccination and booster shots. Along with testing, Orange County Health Services also provides free COVID-19 vaccinations at Barnett Park near the Orlando Fairgrounds. Barnett Park is open daily, again between the hours of 9 a.m. to 4 p.m. and soon will go to 5 p.m. On weekends, the children's Pfizer vaccine is available. Appointments are recommended for children ages 5 to 11, and a legal guardian must be present with the child. I do want to say thanks to the partnership that we've had with the Florida Department of Health, State Health Officer Dr. Pino. He's been a great partner. The I Got My Shot mobile vaccine trailer continues to serve our community. The Department of Health will be providing free vaccines tomorrow morning between the hours of 9 a.m. and noon at the Consulado de Mexico. Tomorrow afternoon, it will move to the Ivy Lane Neighborhood Center between the hours of 3 p.m. and 5 p.m. Again, more information about the vaccine locations can be found at ocfl.net/vaccine. Now let me just share with you the latest numbers here in Orange County. There are now over 252,000 coronavirus cases reported in Orange County. The number of Orange County residents who have died from COVID-19 is now 2,291. Our hearts and prayers go out to each one of those families who lost a loved one. Since children as young as 5 years old can now be vaccinated, here are the latest figures. 74% of residents ages 5 years of age and older who have had at least one dose is pretty significant. And 45% of residents ages 5 years and older have completed the full series. So there's still some work to be done there. We want our residents who are eligible to complete the full series to do so. The 14-day rolling positivity rate has risen significantly. As of today, it is 14.60%, so nearly 15%. That is 3 times as high as what the CDC regards as containment of the virus, which is to have a rate of 5% or below. I want to stress again that we all need to do our part to keep our families, friends, neighbors, and co-workers safe from the virus. This includes getting vaccinated, wearing a mask, avoiding large indoor crowds, and continue to social distance where appropriate. Here in Orange County, we are putting COVID precautions into practice. I have mandated that all Orange County employees wear their mask while on the job. Last week, we had 19 employees who had tested positive for COVID. Today, we have over 80 of our own employees who are out positive with COVID. I dare say that most of them are public safety workers. And of that number, many of them come from our fire department. They're firefighters. I have 2 sons who are firefighters. So to protect our employees and those who use our services, they will be wearing masks for the foreseeable future. You know, there's one exception. If they have a medical condition prohibiting the use of facial coverings. Now let me just share with you a little bit, I think, good news about our emergency rental assistance program. If you are behind on your rent and you need assistance, I want to remind you that our emergency rental assistance program is open and taking applications. The program is funded from federal relief dollars, and it offers up to $30,000 worth of assistance and now may cover up to 3 months of future rent instead of just 1 month. This means eligible residents can receive up to 12 months of assistance with past due rent and up to 3 months of future rent assistance, totaling up to $30,000 in emergency rental assistance. To date, our Orange County staff has assisted over 2,800, to be exact, 2,867 families who have qualified for help with their rent. They have therefore avoided eviction. $16 million has been approved for distribution to keep Central Florida families in their homes. Residents who need information about rental assistance can go to ocfl.net/rental assistance to review the program details. If you need assistance with mortgage payments, then you have to make application through the state's processes. Our local counties are only set up for rental assistance, not mortgage assistance. Before Dr. Pino comes up to speak, I want to point out that our Public Safety Director, Danny Banks, is here, along with the Orange County Utilities Director, Ed Torres. Our Utilities Division has been monitoring the wastewater numbers with the spread, with the spread of the virus now for months. The numbers are staggering today. I'll let Ed Torres at an appropriate time get into the most recent numbers. As you know, Orange County Public Schools is closed for the holidays, and so Scott Howard from the school district is not here, but he has shared that the school district continues to monitor the numbers and respond to media requests as appropriate. And now I'll turn it over to Dr. Raul Pino.
Good afternoon, everyone. Today, a lot of numbers and information and some records. So yesterday, we probably have a record of testing in our county. Yesterday, we performed 10,820 tests in our county, although that's a very high number. It's not meeting the demand that we have in the public. And our kudos goes out to the county by duplicating the number of tests that they offer. And now with the third side, things could get a little bit better for people. The total number of positive cases in our county, 252,327. And yesterday was also the highest number of cases reported in one day during the entire pandemic. And we got over 2,500 cases reported yesterday. That is 724 cases higher than the day before. Our 14-day rolling average is 14.6. And as the mayor mentioned to you, when we talked to you past 2 weeks ago, that was 3.8. Our 7-day average incidence rate, which is per 100,000, is at 782 cases per 100,000. That put us on high transmission level on the CDC scale. The number of deaths, as the mentioned Mayor to you, 2,291, 8 additional deaths were reported since our press conference. Of course, our thoughts, prayers with the family and friends of those who has passed, especially hard during the holiday season. With regard to the death, to mention a few things, They are getting a little bit older. The median age is now 73, which is the oldest we have been in a while. And also, let me mention this to you, that the highest number of cases, it is between 25 and 34 years of age. They are representing about 25% of all cases in the daily count in our county. As the mayor mentioned to you, Omicron has been officially detected, 7 cases in residents and a few more waiting to be confirmed. Those were done through genome sequencing, so that means those are past cases, not yesterday, but a few days. For the vaccination update, and this is first dose, although those numbers are good, remember that we need people to get the second dose, and I'm going to make emphasis in the number of people that have not been vaccinated with the second dose. And for those that needs to be boosted, please get your booster. That's what's going to give you the high level of defenses against the Omicron variant. The total population 5 and up in our county, 73% of our population has at least one dose. From 5 to 11, we are at 21%. 12 to 17, we are at 70% with at least one dose. We also do school age, 5 to 17, and that's at 44%. We want it to be at 50, so we are getting close to that. 18 years of age to 64 years of age, we are at 78% with at least one dose. And people 65 years and up, we are at 90% of at least one dose. But also we have residents missing doses. We believe that we have about 112,396 as of yesterday that are missing their second dose. Now, it could be that the number is not exactly that, because if someone got a second dose in another state, we may not have that information yet, but the number is very close to that. And residents missing boosters, 590,767 as of yesterday. And that's 43% of the eligible population. So people need to get on, get the boosters, and get their second dose if they need it. With regard to the mayor mentioned to you that we are in contact with the hospital systems with regard to hospitalization. Although we have seen very high numbers of infection, it has not translated yet in many hospitalizations, fortunately. So let me give you the numbers that we have yesterday from the 2 largest systems. Yesterday, they have 162 residents of our county that were hospitalized. And if you remember, this number in the peak of the Delta variant used to be in the 400s. 11 of those cases were pediatric hospitalizations. 70 individuals were in ICU. 3 of those were pediatrics. And 14 individuals yesterday were on ventilators. A lot of people are asking what to do. I think that by now we should all know what to do. And the increase of the number of testing is also that people are learning what to do. And it's before you travel, before you congregate, get tested. Be sure that you are not transmitting the virus to anyone. And that's why we have seen those increases. In case that you can't get tested, but you are symptomatic, you have fever, you have cough, you don't feel well, isolate, mask yourself until you get tested, until you can get tested. Also, yesterday were changes in CDC guidelines for isolation and quarantine. I'm going to explain it only for non-healthcare workers, for the general population. The healthcare workers is a little bit complicated to explain in this format, but the information is on CDC website, because it also takes into consideration what situation the hospital is. Is it an emergency situation? is in red code, is in white code, and then the situation change, and that would be very confusing. But basically, they simplify everything. 5 days of isolation, 5 days of quarantine. If you don't have symptoms, then you can return to work as long as you mask yourself, and you need to mask for additional 5 days. So up to 10-day mask for those asymptomatic, for those symptomatic with infection, and for those in quarantine for 5 days. We also want to encourage parents to get their children vaccinated. As you have been reported in the news, there has been an increase of hospitalization for pediatric cases in places that are ahead of us in this Omicron curve. We don't want that to happen here. So please, please get your child vaccinated. Thank you.
I'm going to ask Ed Torres, our utilities director, department head, to come forward and just kind of share with you what they are seeing in the wastewater surveillance testing. Ed? Then I'll open it up for questions after that.
Good afternoon, everyone. As Mayor Deming mentioned, we have been sampling for SARS-CoV-2 RNA for several months now. We started back in May of this year. And if you recall, at that time, our concentrations of the COVID RNA were around 200,000 gene copies of the virus per liter. Over time, we saw concentration spike back in July to a high of 3 million gene copies of the virus per liter, and again in September up to 2.8 million copies of the virus per liter. Those concentrations went substantially down recently, back in November or so, and the concentrations that we have received for last week, last Thursday, unfortunately has spiked up as high as 3.2 million gene copies of the virus per liter. Again, that's a record for us, and it's a record, I think, for the area, since I have been sampling this since the beginning of the pandemic. Again, 3.2 million copies of the virus per liter. As you know, this is an indicator and a predictor of clinical cases in the area. With regards to the Omicron variant, our latest results also show around, let me look that up real quick, around 89% in some of the areas being Omicron. Actually, 89.9% on our south service area, 84.9% on our eastern service area, and 93.3% on the northwest service area, again, of Omicron. We still have Delta and Delta Plus circulating in the community. That's the remainder of the percentage. So obviously we need to be very cautious.
All right, thank you, Ed and Dr. Pino. We will open it up for any questions that you all may have, and just as a reminder, there will be a microphone that will be moved around today, and so if you can wait on that. All right, first question.
Yes, this is Melissa Thomas with Florida National News. This question may be for Mr. Torres, actually. In terms of what you're seeing from the wastewater, are you seeing a concerning catch-up, if you will, between Omicron as it relates to Delta and the other Delta variant as well, like Delta V? Like, is it catching up closely to those that you've noticed?
Well, as I mentioned in the last press conference, we had seen with Delta and Delta Plus, we saw a gradual increase from Alpha transitioning into Delta and Delta Plus. With Omicron, as we reported, in a matter of a week and a half, we saw a complete transition to being the dominant variant.
Sí, buenas tardes, doctor Pino, en español, por favor. Un resumen de la jornada y la pregunta. ¿Por qué ese incremento en los centros de test de COVID, mucha gente hoy se estaba retirando frustrada porque no encontraba su cita y las filas son de más de 6 horas de espera, incluso 7 algunas personas. Pregunto, ¿qué mensaje hay para esas personas?
Mira, hay una realidad que tenemos que tener en cuenta y es que el nivel de demanda que hay hoy para hacerse las pruebas, nadie lo va a poder responder a los niveles que estamos viendo de demanda. Como explicó Mr. Torres, esta ha sido una variante que ganó, se transmitió rápidamente, muy rápidamente, y en otros lugares ha decrecido también de la misma manera rápidamente. Yo le pido a la gente que traten de sacar cita para los lugares que dan cita para hacerse las pruebas. Todos los lugares están llenos. Yo visité CVS este fin de semana y estaban llenos y no habían suficientes tests para vender de los que están haciéndose en la casa. Nosotros distribuimos más de 100,000 tests a través de las escuelas. Hemos pedido una cantidad similar para distribuir de nuevo en cuanto lleguen, pero la realidad es que no hay las suficientes pruebas. Lo que le estamos diciendo a la gente es, siempre y cuando tengas síntomas, si no te has podido hacer la prueba, sepárate de tu familia, vete para la habitación, ponte una máscara y protege a todos. Asume que tienes el virus. So the question was that in the current conditions with the high number of people looking to be tested and the long waiting areas, and some people getting very frustrated and returning home without being able to get tested, what people should we do? What is the advice? So I said that the reality is that the level of demand that we have for testing is not going to be met right now, today, at the levels that we have seen that demand. I can tell you that if we open 5 sites, the 5 sites will get full and the 5 sites will have a 2-hour waiting line. That's a reality. A lot of people are wanting to be tested. And perhaps the change now, the administration is going to take at the federal level to mail testing kits is a better approach for these high volumes because these sites are not designed to take care of the entire population. You can't do that through a drive-in site. It's just impossible. And the advice is always, if you feel that you have been exposed, if you have symptoms, even if you are not being tested, assume that you are positive. Isolate yourself, protect your family, mask yourself until you can get tested.
Okay. We'll go to the next question.
Hello, perfect. This is another question for Dr. Pino. If you could first start by repeating some of the data that you provided about the vaccinations for elementary through high school students and speak to any conversations that have been had with Orange County Public School leaders about preparing to welcome students back who will start school again next week as we monitor cases going up.
Yes, with regard to the vaccination rate for the students, and let me give you, because I also have all the different rates, not just one dose. And because you only asked for that age group, I can give you more information. So, for example, 5 to 17 with at least one dose, 5 to 11 with at least one dose, those numbers are 26,733, and that's about 21% of that population. That are missing the second dose is almost half of that, 11,994, which is at 12%. And then people on that age group that have completed everything, 14,738, and that's at 12% of that population, 5 to 11. Now 12 to 17, which includes high schools, with at least one dose, 75,630, and that's at 70%. And with missing the second dose, 15,225, that's 53%. that have completed either the series or has a booster, there is 2,757 on that age group had an additional dose, and 72,386 have completed the series. So that's what's giving you that number. And now 5 to 17, which include everyone in a school age, with one dose, 102,363, which is 44%, that are missing a second dose, 27,220, which is 12%. And that have completed 5 to 17, that have completed everything, is at 32%, with 74,915. Yes. So we are in constant communication with the school. We have, what we have done recently with the schools is that we distributed, as I mentioned before, over 100,000, I believe the number is 126,000 test kits at home for students and employees of the Board of Education. And we also have done 2 rounds of vaccinations in the recent wave of vaccination. We also did it before, but now, and they have a third starting in January. They will come around again through the higher school for anyone that is missing a second dose or anyone who may want to initiate their vaccine series. And also we continue to work with them on trying to develop a testing strategy for schools. And I know I have talked about these a few times, and we haven't been able to put it all together because it's quite complicated to go into the schools to do testing for students, concerned parents, and all the logistics that go with that. But we will continue to try to work it out so that we can offer testing in schools, I mean like physical testing, but also, again, we requested additional over 200,000 actually. We requested 200,000 additional test kits to be able to distribute to the schools, students, and employees.
Hey, Jerry asking for Mayor Jerry Demings, please, Channel 6. What's your advice for people or words for folks who may want to go out and party and have a good time this New Year's holiday weekend amid the Omicron surge?
What I say to those individuals who desire to go out is you do so at your own risk. But if you're going to do so, you ought to really seriously consider making certain that you have at least been vaccinated or you're wearing facial coverings at the very least in order to protect yourself. It is moving, obviously, very rapidly through our community. And I really don't want anyone to contract the disease.
Mayor Demings, Asher Wyman, Channel 13. It's kind of a follow-up to Jerry's question there, though. You have 2 big bowl games this week that are going to have over 60,000 people per night in the stadium. Downtown is going to probably generate 100 to 200,000 people. We did get a response from the governor's office last week saying that it is not against Florida law for businesses to have a mask policy, but government entities cannot enforce mask mandates. We saw Universal put one in. How would you tell residents the county is trying to continue to keep people safe, knowing all these events are coming into your county, especially here at New Year's?
I do applaud the local businesses for taking control and leading to try to protect their patrons. I applaud the NCAA for the protocols that they're putting in place, because if the individuals who will be attending these events are going to have any direct contact with the players, coaches, or staff, then they are required to meet certain COVID safety protocols in order to have that type of access. That does not address most of the fans who are going to be in the various stadiums. So I believe that without a doubt, from some of these large gatherings, there are going to be consequences of those gatherings. We know that we probably are going to continue to see an increase in the number of individuals who are going to test positive for COVID-19. So anyone attending these events, they do so at their own risk. Again, here at the local level, our ability to hold accountable, to enforce any of the safety protocols has now been legislatively taken away as a result of the special session. As I said earlier, I think Florida residents ought to be outraged about it because that simply means that more individuals are going to needlessly be exposed to COVID-19. And those consequences are unknown at this point. So call your governor, call your state legislators who enacted these new prohibitions. I said all along that when it comes to fighting COVID, the fight really starts here in the local communities. When people are in trouble and they need medical assistance, what do? They dial 911. They seek out local assistance. They don't call, for the most part, the governor's office or the legislators. They call them brave men and women who are our first responders, who are on the battlegrounds, if you will. They rely on our healthcare workers, the people working in our hospitals, to take care of them. All of them, we know, have been chronically stressed, overworked during this pandemic, and unfortunately, we have seen the politicization of the virus, the pandemic, that has resulted in, I think, less than an efficient way to respond to the pandemic. So here we are, trying to do the best that we can do today under the current environment.
Mayor Ryan Gillespie at the Orlando Sentinel, jumping off your comments about the lack of support you're feeling from the state of Florida, what kinds of things would you like to see or need to see to fight this variant from the state and the governor?
Well, you've heard about the shortage of available testing. Early on there were state testing sites, state supported. We don't have those for the most part here in our local community. And so our local governments have been asked to step up to the plate and make adjustments. It is through the resources that we have available here that we are paying this tremendous cost of providing free testing to residents. And we're being overwhelmed because of the visitation, the tourist numbers being up. We have a lot of people here in the area who are visiting our theme parks, visiting their families, and before they're able to travel back to places they came from, they are required to be tested and want to be tested. And so they too are impacting the numbers. And so this isn't a problem, if you will, that is unique to local governments. This should have been addressed both by the federal government as well as the state government. And right now, the missing middle here in the state of Florida in this fight, the current circumstances that we're dealing with, is the state.
Working? Okay. Kelsey Thord with West 2 News. My question, I'm not sure if it's for the mayor or for Dr. Pino, but you've talked a lot about testing. Is there any...
That's a better one. Well, we know that the Biden administration has announced that the plan is to distribute, I think, 500 million at-home testing kits at some point in January. Unfortunately, at this point, we don't have all of the details of how that is going to be rolled out, but we are anticipating that more details will come from the federal government within the next few days. Dr. Pino can add to that.
So I can add to that. The county has been distributing at-home kits. We we gave the school about 126,000 within a month. What they have left, I believe, today is about 5,000. We requested additional 200,000 to continue to distribute that way. If we have additional resources, we probably will consider point of distribution, but we are not there yet because we don't have the kits. So we don't want to talk about that possibility, but it's possible. But again, our allocation of home test kits, our decision with the schools was that we needed to improve the level of infections at the schools at the time when we were doing the Delta, and that's where we dedicated all the resources to.
Did you have a follow-up, Kelsey?
This last question was texted in from Ryan Lynch in the Orlando Business Journal for Mayor Demings. The question reads, Mayor, what kind of conversations, if any, have you had with local businesses tied to the latest spike? What are you looking for out of them during this time?
You know, we remain hopeful. We have had conversations with numerous local businesses as well as our large theme parks, and most of them, as you know, have made some modifications in terms of requiring the wearing of facial coverings or face masks for their guests. And I think that given the current situation, is the right response to the spread of the virus. The goal is to stop the spread of the virus. Okay, and with that being the last question, you know, the takeaway from today is that things are bad, but not as bad as if our residents had not gotten vaccinated over the last year. Dr. Hendricks from Florida Hospital, Advent Health, released a statement earlier today, and in the statement that he released, and I'm going to quote what he says in this statement. And again, this is Dr. Tim Hendricks, who is the Senior Medical Director for Advent Health for the Central Cares. He says, quote, "We are seeing record high positivity rates at our Advent Health Central Care locations with a concerning upward trend. What is encouraging is that a very small percentage of those testing positive have received their booster shot, which tells us that boosters provide very good protection against the Omicron variant. Now is the time to get your booster shot if you haven't already. And we recommend that everyone practice good safety precautions of masking and social distancing in indoor spaces and whenever you're around other people." End of quote. Again, thank you all for attending today. We certainly wish all of you a happy new year.